Today we're going to be learning how to properly chart using the SOAP method. SOAP stands for Subjective, Objective, Assessment, and Plan. We're going to go ahead and go into a lot more detail soon, but before we get started, let me tell you a little bit about the Home Clinic. The Home Clinic is a student-run clinic that takes care of the needs of the disadvantaged population of Fort Worth, Texas. We focus on providing education, screening services, and referrals to our patients. Our team is composed of 5 coordinators. We have Tyler Ulmer, Sarah, Mark, Kelly Johnson, and myself, Robert. Every visit, we have a different physician that helps us out, but our group advisor is actually Dr. Podowitz. In addition to our services, we also work with other organizations in order to benefit our patients. Now, something that we have to pay attention to is being able to distinguish what the patient tells us from what we observe during our examination or whenever we're taking vitals. So this will be comparing the subjective information with the objective. Okay? Something is said to be subjective if it is the patient the one providing us the information. For example, the history of present illness and the review of systems are both considered to be subjective because it is the patient providing the information and not the physician doing an actual measurement or an actual examination. On the other hand, vitals and examinations are considered to be objective because it is the physician the one conducting this test or this series of events. The last two components of the SOAP note are going to be the assessment and the plan. For example, if somebody comes in with hypertension, what we're going to put over here is we're going to put a number 1. We're going to write down hypertension, and then we're going to write down a plan. Now, let's say that they have enough supply of their medication for this upcoming week. Well, we're not allowed to give them medication, and we're not allowed to refill their medications as well. So what we can do is instead we can refer them to a place where they can get all that. In addition to that, if you educate them about the need to reduce their salt intake, you can also write that down over here. You write another number 1 over here because we're referring to the same condition, and you put patient was educated about healthy habits. So that we have a basic overview of the chart, we can go ahead and expand and look into how the clinic would run the day that we visit. So the first thing that we're going to do whenever we get to the place where we're going to be volunteering is we're going to split the group into 2 different groups, and some people are going to be doing triage and the other people are going to be seeing patients. So the people that are doing triage are responsible for collecting all of the personal information, the chief complaint, and everything in this box, including past medical history, family history, and social history. It's very important that we collect all of this information. Don't be afraid to ask questions. I noticed that a lot of people have a difficult time asking about recreational drugs. Something that you can tell them is that all the information that you're collecting is going to be confidential, and it's just a way for us to provide a better service to them. Okay. Now the other group are going to be starting over here. Where it says student doctor, you write your name and you start doing your history of present illness. Try to use the old CARS mnemonic. There are other mnemonics out there. The important thing is that you collect a good history, because according to many doctors, you can get your diagnosis 80% of the time just from the history alone. So history is a very important component of your chart. Okay. Remember, don't be afraid to ask questions. We're there to learn. Be, however, sensitive. If a patient does not want to talk about something, don't force it. Okay, now let's move on into the review of systems. Notice how we have a whole list over here and a lot of things to ask. Now, if we were to do one by one and system by system, patient to patient, it would take us hours or days to get through all the patients that we have at the clinic. So this is not something feasible for us and for the patients as well. So instead, what we're going to be doing is we're going to be asking the patients, have you had any trouble with your eyes recently? Have you had any trouble with your nose? Any trouble with your mouth? More general things. If you get to the gastrointestinal system, for example, and a patient tells you that, well, I've been having a lot of reflux recently. well, then you want to expand in there. So, well, you start asking them, have you had any diarrhea, constipation, change in bowel movements? And then you expand and you want to try to get as much information as you can from that. But don't go in from system to system, because that's going to be taking us a whole lot of time, and that's not something that our patients would appreciate. All right, so now that we've completed the history of present illness and the review of systems, we can go ahead and move into taking the vitals. And remember that your patients have the rights to deny or accept any of the uh, examinations or vitals as well. So if they don't want to get their glucose done, then don't force them as well. If you have any questions about how to perform a test, just ask for assistance. Look for a coordinator. We're there to help out. The first thing that you do whenever you observe an abnormal value is to recheck or redo the test. For example, if you get an abnormal value for the blood pressure, the first thing that you would do is you would try the other arm, or you would you would recheck it. Don't just assume that that's the abnormal value. In addition to that, keep in mind that some people may have a very abnormal result for their examination. For example, some people may come in with a blood glucose level of 600. Uh, Now, the key here is we need to be able to distinguish between something that is a medical emergency and something that is not a medical emergency. If a patient shows up with a blood glucose of 600 and they're sweating and they're lethargic and they're unable to stay awake and maintain a conversation, then that's a medical emergency and they need to go to the ER. But if somebody is able to maintain a conversation and they seem just normal, uh, but they still have the same glucose levels as 600, then that's not as much as an emergency. They do have to get it treated, right? And that's something that they have to get under control, but it's not something emergent at that particular time. Now that we're done with the vitals, let's go ahead and move into the physical examination. And the two that we really ask you to do in every patient are going to be the respiratory and the cardiovascular examination. So we ask you to do this test in every single one of your patients, unless of course they deny, they do not want it, they do not want to get this examination. So then that's fine. But we really expect you to get to listen to their lungs and to their heart as well. Um, you can also conduct any of the other examinations if they're relevant to the information that your patient provided, either through the review of systems or the chief complaint, or during the encounter, something that came up during the encounter. That's all the information that I had for you. I would invite you to participate as much as you can with the home clinic, as this is a wonderful opportunity to not only serve your community, but also practice your medical skills as well. Thank you so much for watching. And the last thing that I want to do is I want to tell you that we have to always remember that we're not in the business of treating disease, but we are in the business of treating people who suffer from disease.